Next on our agenda, we have House Bill 199. Senator Kaiser. Please state your name and the time is yours.
Thank you, Madam Chair, Committee, Senator Kaiser, District 20. Before you is House Bill 199. This is regarding the Refugee Medical Assistance Program. And this, like
Senator Kaiser, can you get a little closer to the mic
certainly.
for our online people?
Thank you, Madam Chair. Committee, before you is House Bill 199 regarding the Refugee Medical Assistance Program. This started back in 1980. Like many bills that we've heard thus far, this was to move a rule into statute. The substantive change was that in this medical assistance program, those that make more than the allowable federal poverty guideline of 133%, they were given extra grace. They were allowed to make more money, up to 150% above the federal poverty guideline. So when moving this rule into statute, catching that disparity, this got lowered down to 133% to match what other Idahoans get. In this program, refugees also will get cash assistance. They'll have sponsor programs, in-kind services. None of that goes towards their income level. So again, this is just matching what other Idahoans get at 133% of the federal guideline. And they'll still have a benefit where if medical costs that are accrued during the year, they can actually use that and deduct from their income total. For example, if they made $40,000 in income but had $10,000 in medical expenses, they can actually subtract those medical expenses from their total, lowering it down to $30,000 of income, with the goal of potentially sliding back under that federal poverty guideline. Now, Idaho receives approximately 1,000 refugees per year. Currently, only 19 are actually eligible for this extra benefit program. Total medical costs in 2024 was about $223,000, but the total cost itself to run the program was over $1.1 million. So when looking at, again, moving rules to statute, trying to honor the fiduciary responsibility to the Idaho taxpayer to limit bloat, looking at this program, it was worthwhile to remove that and again match every other Idahoan at the federal poverty guideline of 133%, where everyone would still qualify for Medicaid under that percentage of the program. So that's it in a nutshell. I would urge your aye vote and stand for you for questions.
Questions of the committee. Senator Lenny.
Thank you, Madam Chair. Senator Kaiser, you said 19 individuals are on this currently. Is that what it was?
Senator Kaiser.
Madam Chair, Senator Lenny, that's correct. So currently only 19 individuals in Idaho are eligible for this extra benefit.
Follow up. Senator Wintrow.
Thank you, Madam Chair, and thank you, Senator Kaiser. I appreciate the stats. You've done some homework. So here's my question. I think I might have asked this before I was pondering it, is I wonder why this was set at the level it was in the first place. I started to think about, who is escaping their countries to come here and maybe what kind of things might be going on to have set it there in the first place. I don't know if you came across that in your kind of research.
Senator Kaiser.
Madam Chair, Senator Wintrow, I appreciate the question because I had similar questions, having been to third world countries, a dozen of such. I was concerned perhaps maybe they had additional medical needs that necessitated this kind of program. And what I found that wasn't exactly the case. This program's been around since 1980. And again, the medical costs didn't match the amount of administrative costs that to keep the program running. Given that there's additional cash assistance and sponsors and in-kind services available, those that have a certain amount of income will primarily still be able to qualify for Medicaid upon arrival here.
Okay.
Follow up.
Thank you, Madam Chair and Senator Kaiser. So in your research then too, were you able to determine maybe characteristics or kind of a read of those 19 folks and maybe what was going on in their lives in that eligibility and how they were using it? I don't know. That's probably pretty tough to get. but maybe a big snapshot, I don't know.
Senator Kaiser.
Madam Chair, Senator Wintrow, no, I never met with the 19 eligible individuals in this program, but obviously, through that transition here, there's a lot of circumstances that could be quite daunting and scary in that transition, and obviously want to be able to provide them services to ease in that transition process. But in this particular case, I didn't investigate further.
Any more questions? Seeing none, would you like to close?
Again, moving rule to
Oh,
statute.
just a minute. I have some people to testify. Sorry. I was getting ahead of myself here. Okay. Holly Beach. Okay, we have 2 minutes for each testifier. Please identify yourself, and the time is yours.
Hi, Chair Van Orden and committee members. Thanks so much for having this opportunity. My name is Holly Beach. I'm the communications manager at the Idaho Office for Refugees. And I know a number of you joined us for our appreciation luncheon here at the Capitol last week with the dairymen. So thank you for coming and enjoying some good food and conversation with us. So most of us know that refugee resettlement is not new to Idaho. We've been formally welcoming folks since 1975. Idahoans support refugee resettlement by a wide margin because it's the right choice, it's the smart choice, and it's who we are as Idahoans. Over the past decade, 600 unique Idaho employers have benefited from the talent of refugee employees, from jobs, entry-level jobs in hospitality, retail, to construction, farms and factory floors, to our schoolrooms, universities, and doctors' offices. Our office and the Idaho-based resettlement agencies that we work with routinely meet families who have fled violence and persecution at the hands of their own governments, the definition of who a refugee is. We provide critical services from picking them up at the airport, some traveling with only the clothes on their backs, to helping them find housing and their first jobs. In return, they become our neighbors, our friends, employees, colleagues, business owners, and Idaho taxpayers. A study released last year shows that refugees nationwide paid nearly $124 billion more in taxes over 15 years than they received in public benefits. With all this in mind, the people we have welcomed to Idaho for over 50 years, escaping war and persecution, some for supporting the U.S. military overseas, often these folks have had interrupted health care and, or maybe no health care during their time in a second country after being displaced. This bill will make it harder for a small group of people that our government has strategically and intentionally welcomed to the U.S. to get care during their first year of arrival. Refugee medical assistance does not cost Idaho taxpayers additional money. Providing a quick pathway to self-sufficiency is our aim in resettlement, and access to health care makes this path smoother. It is important for all of us to be reminded that refugee resettlement is our moral calling and our legacy as a state and as a people. I'd be happy to answer any questions.
Thank you. Questions? Senator Wintrow.
Thank you, Madam Chair, and Ms. Beach, thanks for testifying. You heard my question to Senator Kaiser about, why would we have set it this high? Not that it's all that high, but, why did we set it there in the first place, and how would retracting that impact folks?
Ms. Beach.
Oh, thank you, Chairwoman. Senator Wintrow, I wasn't part of those discussions or have the history on that. But I do know that when people arrive, having the additional support and wraparound services does lead to that smoother pathway to self-sufficiency. Many of the people that we welcome go on to get jobs in their first 4 months, and often those jobs do come with health care, which is the goal for everybody involved to be able to rebuild in peace and have the resources they need. So it could have been that after going through such a traumatic event and having to start all over, maybe that extra support initially would allow for self-sufficiency to be reached at a better rate.
Okay, one follow-up.
Follow-up.
Thank you, Madam Chair and Ms. Beach. I appreciate it because I've been trying to wrap my head around this because my sense is, Boise and Twin Falls were refugee resettlement areas. I know we see the benefits of refugees in our community. I see them in my grocery and we see them in a lot of jobs and so forth. So I don't think anybody has ill will. But I started to think about this. We have a law that's called Medicaid for Workers with Disabilities, and we actually set the income levels higher for that group of people because we recognize we want them in the workforce, and we wanted to allow that higher income so they could not spend all their money on medical benefits and those kind of things. So I'm wondering if maybe there is a small group of people that has a little bit more than most, And if we were to not include them, then that would be kind of almost an inhibitor, and then they would have to draw out of the assets they have instead of getting that boost into the economy. Does that make sense?
Ms. Beach, I don't know if there was a question in there, but you're welcome to comment.
Chairwoman and Senator Wintrow, I believe that makes sense. It's like we mentioned, the numbers are not astronomical, but for the lives that it will make a difference in, it will make a difference. And it could access the kind of health care they can get based on what private insurance they're able to get. There are strict guidelines for refugee medical screening. Every refugee who arrives here has to get a refugee medical screening upon arrival, and then in a year when they get to adjust their status and get their green card. And so there are guidelines federally set for that screening. And there's a lot of trust building that needs to take place in that conversation, language access, cultural access. We have amazing providers here in Boise who are the main partners that do the screenings. And so to push someone into a different insurance model might not allow them access to those specific providers.
All right. Any more questions? Seeing none, thank you. Thank you
Thank you
for
so
being
much.
with us. Okay, next we have Angela Bangs. Welcome to committee. Please identify yourself, and then the time is yours.
Can you hear me okay?
Yes,
Okay,
you'll have
very
to talk a
short,
little
so-
loud. Yeah,
Okay.
gotcha.
All right. Chairwoman Van Orden and members of the committee, my name is Dr. Angela Bangs, and I'm a family medicine physician in Boise. I stand in opposition to House Bill 199, and I am representing myself. I became a family medicine physician because of my desire to help people, especially those who are from our most vulnerable populations. And I've decided to stay here because I can care for this patient population. I care for people who have experienced and witnessed the horrors of genocide, people who had to flee their homes, communities, and everything they know to survive, all in the hope of a better future in the United States. I care for multiple mothers who have seen their children and other loved ones and family murdered in front of them. I have cared for fathers who have risked their lives repeatedly to aid U.S. military efforts, and children who have only known life in the confines of a crowded refugee camp. I care for entire families who, despite everything, arrive hopeful and grateful to embrace life as new Idahoans. Many of these families typically have not accessed any medical care for years, but because of the refugee Medicaid program, when they ultimately make it here to Idaho, their new home, they are finally able to access those services. Often our clinic represents their first touch with the healthcare system, and often these families can finally be evaluated for conditions that have been affecting them for years. They also receive a critical and specific medical screening that helps to identify and treat issues of public health significance. Their ability to access healthcare allows these new Americans to return to health, which allows them to work and finally find a safe, productive, and happy life. This bill may feel small compared to many other issues being discussed, but I believe this issue is critical for my patients with refugee status. Losing Medicaid funding would be absolutely devastating for this small and vulnerable group of new Americans and Idahoans. Please do not make it harder for people fleeing war and persecution to access basic health care once they finally make it to safety. I urge you to vote against House Bill 199. I'm happy to stand for questions.
Thank you. Melissa, or Senator Wintrow.
It's okay, Chair. I know I always have a lot of questions, but Dr. Bangs, you heard my question before. From your, I'm guessing there are federally qualified health centers that mostly are taking refugees, and as you said, most of your patients. So tell me what the different, like why is it a big difference to change this eligibility, and what will it do and impact some of the patients that we're talking about? Maybe it's 19, I hear, but what will happen potentially to those 19 if this drops in the eligibility,
Dr. Bang.
if you know?
I guess it's hard to look into the future, but I would say that, healthcare is so important for these patients, even if it's just 19. In many cases, they have a lot of things going on, and our ability to help plug them into the system and get them the access they need is the first step to actually living their lives And I think I'm really concerned that losing any ability to access care, any more barriers that are put in front of them will just really damage their ability to live like healthy and productive lives. I don't know if that answers your question, Senator Winthrop.
Thank you. Any more questions? Seeing none, thank you. Thank you for being with us. Okay, next I have Hannah Habienza. I'm sorry if I butchered your name there. Welcome to committee. Please identify yourself and then the time is yours.
Thank you so much for having me. My name is Hannah Habineza. I'm a refugee medical case manager at Full Circle Health. I'm representing myself today. I'll speak from my heart on behalf of many.
If you move closer to that mic and speak up, we'd appreciate it for the people online. Thank you.
Yes, my name is Hannah Habineza. I'm a refugee medical case manager at Full Circle Health, and I'm here today representing myself. So I speak from my heart on behalf of many refugees in my day-to-day work that I've seen. I'll start by saying that I came here to the United States through the Refugee Resettlement Program, and I'll say that the refugee population are people who are very resilient. We come here through this country, fleeing from wars and persecution, and we get here to this is a new country, new place, new system, new language, new everything. But against all that, we rise above and go to work. We pay taxes. We find with most of the time within the 5 years, refugees are able to buy their homes and they're paying these taxes. So I stand against this bill because I have seen many times where refugees have to choose between work and their health. They come here with so many medical conditions and they want to seek. Finally, when they come here, they say that we are home. We are going to get access to medical care that we deserve. And so when they get here, and if they lose this assistance, then they're having to either stay home and not go to the hospital where they're going to get the care and then continue to work. And maybe they're not even able to continue to work because of those health conditions that they have. So I would really like this assistance continuing so they can receive the care and continue to push through self-sufficiency in their new home, as they call it. Thank you.
Any questions? Seeing none. Thank you. Thank you for being with us today. Okay, committee, I think that's all I have. Would anybody else in the audience like to speak to this bill? Seeing none. Senator Kaiser, would you like to close, please?
Thank you, Madam Chair. It's so wonderful to live in a state that values refugees and is willing to invest in helping other people. I think it reflects the heart of those that live here, and I'm thankful to be a part of that. This program doesn't remove medical services to refugees. 100% of those that come here will receive a medical screening. 100% of those that make 133% above the federal poverty line of income will be eligible for Medicaid. So the only change is the extra percentage, of which currently are eligible are 19. Not every year someone's eligible for that program. But out of all the refugees that come here, a small group qualify that make more money than everybody else, including every other Idahoan. And so while moving a rule to statute, we corrected that percentage because it is unfair for every other Idahoan that doesn't receive extra benefits that might want additional medical care. So 100% of those that come here will receive medical screenings. They'll have medical services available. Those that make 133% above the poverty line, like everyone else that lives here, will be eligible for Medicaid and have their medical needs met through that program. So that said, I urge your aye vote. Thank you.
Thank you. Okay, committee. Senator Lenny,
For a motion,
a motion's in order.
I move that we send House Bill 199 to the floor with a due pass recommendation.
Been moved by Senator Lenny, seconded by Senator Shippey to send House Bill 199 to the floor with a due pass recommendation. Do we have any more discussion? Senator Winthrop.
Thank you, Madam Chair. It's clear I'm opposed to the motion. And the reason why is I do think that refugees coming here face many additional barriers than any natural-born citizen. I can't imagine moving to another country right now, let alone if I was the survivor of some of the violence that refugees have seen. And we want to welcome people who are being persecuted by their governments and so forth to be welcome here. That's the heart of our country. And my belief is that eligibility level was there because it would provide a little additional boost for folks who aren't meeting that. And it's not that much more money. And I think if you've come from that kind of area and you have those kind of burdens, that we should see fit to make sure we capture as many people in that group to provide benefits and health care and support, because it'll be that much quicker. They're out on their own 2 feet into the economy. And they only have 12 months to do all this. And last week when we had the lunch, I met people who are very much afraid right now because the federal government had frozen housing benefits, and they didn't know how they're going to pay their rent, let alone their health care. So I would ask this committee to please still allow the program with that additional eligibility, because those 19 people are still people fleeing from very awful circumstances. And it would go a long way if we would support them and keep this program as it is. So that's my plea to the committee. Thank you, Madam Chair.
Okay, is there any more discussion? Senator Lenny.
Thank you, Madam Chair. I can't see without these, apparently. I was writing down some notes here. Here it is. Currently, we're spending $1.1 million to administer $223,000. $223,000. That seems very inefficient to me. And I mean, what we're doing here is by moving the percent, besides, the bill that moves statute into code, what we're doing is we're just saying that nobody gets special treatment. We're just lowering it to 133% like the rest of us. And I mean, I can't imagine moving to another country and demanding more and free services than the people who live in the country I moved to. So I mean, we're just leveling the playing field to 133%. I think that's fair and it makes sense, and it looks like it's going to save some money too, because it's almost a 5-to-1 cost for what we're paying out. So.
All right, Senator Blaylock.
Thank you, Madam Chair. To speak to the motion, I don't know why this one just hurts my heart a little bit. I think because it does affect such a small number of people. I don't want to be callous to the fact that 19 people are going to be affected by the vote that we're about to cast. That being said, it doesn't sit well with me either to have Idahoans at a lower rate, understanding even the traumatic situations that they're coming from. And so it makes sense that we need to lower that, because the other option would be that we raise the other level up, and obviously we can't afford that. So I understand. I just want to put it out there that this isn't an easy vote for me, and I don't want to come off as callous and that this is only a calculation of a number. I think it's something that needs to be done for that go forward. Thank you.
Senator Wintrow.
Thank you, Madam Chair. I think, I appreciate Senator Lenny's comment. However, we control the administrative costs, and we as a legislature and sometimes a government create hoops of eligibility checking, and we spend, I think it's $4 million on Medicaid integrity and fraud. And so some of that we've built into the cost of the program, and we could control that. So I do understand what that, Senator Lenny's point, but I think that's within our control. And I do think it is okay It's not unfair, and it's not a special treatment. Maybe it is a special treatment, but to say in our heart of hearts, if you have watched a loved one murdered in front of you and had to leave your country for your own well-being and safety, that we should give you an extra boost. And I'm willing to do it because it's not that much. It's not a ton of money that we're doing, but it matters a lot to those people.
Thank you. Senator Shippey.
Thank you, Madam Chair. I think some of this has to do with understanding priority. When we understand that money or resources is finite. There's not an unlimited amount of resources available. And so there needs to be wisdom in how it's applied and understanding priority. And there's a reason why we have it at the level that we do instead of saying, if you make under this, you're ineligible. We wouldn't prioritize the wealthy to receive free benefits. And so we do understand priorities. I recognize that there are many, many Idahoans who are likely above this threshold slightly that have had traumatic experiences, deaths in their family, who knows what might have happened in their life. But that doesn't automatically qualify them just because maybe they've had those experiences. It bothers me that maybe we would prioritize the resources of the state of Idaho or of the United States to non-citizens over the citizens. It's not to say that non-citizens don't deserve compassion or help from us as Idahoans, but Idahoans deserve help. And so I think it's getting priorities straight. I think it's wise and valuable to do that. And so I will be supporting the motion.
Senator Bierke.
Thank you, Madam Chair. Could easily just sit here and place my vote, but something of this importance, I think, deserves kind of response, maybe from everybody or at least from me. I believe that we are benefited and we're blessed by the folks that we bring into this country, especially those that are fleeing violence. And I think as we set our table, we should all sit around it equally. And as much as I appreciate the situations of the folks that have come here, I really do appreciate the fact that we should have them come in at an even footing. And I think it's important that we don't change those figures to adapt to varying degrees of where someone comes from, but to look at everybody equally. And I think that's the best welcoming we can do as a country, is to say, come in equally and we'll support you here. With that, the appreciation and my heart goes out to the situations that have been talked about here today, but I'm going to be supporting this.
Senator Zeiderfeld.
Thank you, Madam Chair. And after Senator Bierke said that, I guess I better chime in as well. Many of you guys, I've been sharing my history of my family this session a lot. And my family were refugees. They were captured in World War II, put into work camps under Hitler. And when finally the Americans freed them, they came to America. They seen horrific things as well. And when they came to America, they were just thankful to be here. And back then, though, they came through a sponsorship program. The government didn't actually give assistance that way. They had to have a family sponsor them to come to America that helped them with all their needs, made sure they had a job, made sure that they were healthy and knew how to come and be part of America. And they were glad to do that. I think a lot of refugees, when they come here, that's all they want to do, is they just want to be part of freedom. And so I'm going to be supporting this as well, because it's not really taken away from, but it's to say welcome, and this is America, but we also have our own personal, our elderly, have to take care of them as well. And so welcome to America. We'll help you, but you have to help us. And again, it just is part of the refugee experience in my family. If it wasn't for World War II and two people falling in love in a work camp, I wouldn't have my family today.
Okay. Any more? Seeing none. Okay, before you committee is House Bill 199. All those in favor, say aye. Aye. Any opposed? Okay. It's like to be recorded. Okay. All right.